I would disagree with the premise. They could have brought that up. I didn't talk anything about a veto till very late in the session. And the times when the bill came up to increase the income taxes on small business, most Democrats voted against it. They brought those bills up for votes, and most of them voted against it. So it seems like they're saying one thing, but they voted another way.
Well, there weren't very many bills that even came up for vote on the floor of the House.
Well, but that came up for vote, and they voted against it.
Well,
So, I guess either they want the rhetoric but not the vote. Maybe, I don't. But it came up, and people didn't vote for it before the veto threat.
And then he said the same thing about Medicaid expansion, that would have passed but for the veto threat. And since then, we've now had a hospital in Independence close. There's some other hospitals that are on the cusp.
Well, that wasn't a veto threat. I said there are conditions. You'll recall this, Peter, that I want to take care of the wait list first, because these are people that have physical or mental disabilities that we're not providing a full set of services to. And that should be, before we go to able-bodied, you should pay for the full set of services for these individuals.
Well, those are the home
and a work
services, not the medical services.
No, I know, but these are the full set, they're services they are entitled to under Medicaid. And we're working that wait list down, but I said, it's not a veto threat. I said, we got to pay for that first. We need a work requirement because these are able-bodied individuals without dependents that we're talking about expanding it to. So, and then you got to have a funding stream that's going to pay for it long term. So it's not a veto threat, it's just we've got to hit these conditions first that I think most Kansans would say, well, that makes sense. We should do those things first. So they come up with ways to be able to fund that. Good, let's try. I talked with a state legislator from the Independence area yesterday, and he said that Medicaid expansion would not have saved that hospital. Would have helped, would not have saved that hospital. It's hard. The best thing they could do, though, to help rural hospitals is repeal Obamacare. Obamacare took money from Medicare to put it in Medicaid. This is part of the reason I was so opposed to it, because our hospitals, and particularly our rurals, are more Medicare dependent than they are Medicaid dependent. And that would be a far bigger budget number, is if they would do that. And the Senate's voted recently to repeal, I don't know if it was this portion of it, but that took $800 billion from Medicare to put into Medicaid. It's a big number.